Hi, I'm Mary Polcheninoff, and welcome to Sure Things. Thank you for joining us today. Today, our topic is going to be learning more about the Red Cross. As you know, the Red Cross provides vital services throughout the year and especially during other certain events that occur. So to get our show started, I'd like to welcome our guest for today, Ali Barraza. Hi, Ali.
Good morning. Hi, Mary. Thanks for having me.
I'm so glad you're here. Ali is Communications Director for the Red Cross. I was wondering, Ali, with that title too, do you have a territory you cover and I know we talked a bit about how this might be a time limited, but do you have a territory that the Communication Director covers?
Yeah, at this time, I am based really digging into the needs for our Connecticut blood donors, getting the word out to our Connecticut blood donors and those who haven't donated before. So I am our communicator assigned to Connecticut and Rhode Island, and other parts of New England as well.
Wow. Well, thank you for joining us. This is great. You mentioned that you're communication director. What is your background with Red Cross in general? Did you come in as that, or were you affiliated with the organization beforehand?
You know, I came in through the communications department. At one time, I was a strictly regional manager for Massachusetts. And then about a year later, I've been here, hard to believe, it's 2021. I've been here about 5 years almost. So a year after I joined, I became more of a divisional communications director. So really overseeing, again, some of that more broad New England territory, including Connecticut. And, you know, moving into a communications and marketing function going forward after next month. But my background is from TV news. I was a senior producer at one of our Boston TV stations in Boston. And then prior to that, I was a news anchor and reporter in Montana. So that's my background.
Wow, Ali, that's actually very exciting. So this is right up your alley, our little interview today.
Yeah, I do miss having, you know, these opportunities more frequently as, you know, being on the other side of the camera. But like I said, I went into producing years ago before coming into public relations. And now I get to blend the two together, you know, these great opportunities and you graciously inviting me on. So I get a little bit of that, you know, that contact and interaction with media and really be able to kind of drive home our message because it's very important and the need for blood doesn't stop.
Right. Yes. Well, thank you. And I became more interested in having someone come on the show to discuss this because I have a neighbor who donates blood religiously. And I had gone with her to donate blood. It must have been right near the beginning of the pandemic we started. Mm-hmm. And I had donated in the past, but not on a regular basis. Well, once I got into the process and I saw some of the latest and greatest updates and processes. I was just really fascinated by that all. So today I wanted to talk to you about both the whole blood drive and that whole process, how it's changed and how user-friendly that is now, as well as perhaps after the break talking more about other aspects that the Red Cross does address, because I know they're vital in so many areas. So I'd like to start by talking about the current blood drives and how the progress has been on those during these times.
Yeah, I mean, this has just been, of course, just such a almost 12 months now of change and being flexible. We've certainly seen our fair share of challenges at the Red Cross, as many organizations have for the last year, in order to make sure that we can continue our service and maintain our blood products to help patients in need. So things really have evolved quickly and they keep continuing to evolve as the year goes on throughout this pandemic. I think, you know, some of the things that we have really had to focus on are, you know, obviously we need to maintain that social distancing. We need to make sure that in addition to the safety practices that we already adhere to, that we, you know, incorporate those additional measures that have to do strictly with the pandemic. So, you know, at the outset of the outbreak, the pandemic, in March and April, unfortunately, and it was expected, but we really did see a drastic decline in donations. And we also saw an unfortunate, you know, situation where a lot of our community blood drives had to cancel because, and understandably, they want to keep their donors safe. We hold a lot of community blood drives, in places like churches, schools, malls, places that, are trying to adhere to the guidelines, especially at the outset of the pandemic. So we were in a situation where tens of thousands of blood drives had to cancel because of this. So we needed to look for new and innovative ways to collect. We put the word out to donors early in the pandemic. It sounds like you might have been one of them that answered the call to help. We saw such a tremendous response to that, with people understanding that blood donation is an essential service. It is considered that by the Surgeon General. We wanted to make that very clear to our donors that it's just like going to the grocery store or the pharmacy. The need for blood doesn't stop because of a pandemic. So once, we helped our donors understand that really this is an essential service that they are providing, we saw tens of thousands of donations come in, and that has propelled forward the ability to help patients in need throughout the year.
Allie, could you tell us a bit about what changes? So somebody that perhaps has stayed away from blood drives because of the pandemic and they're interested in continuing to donate now, what changes are actually in place now for someone going to a blood drive to keep everyone safe?
Yeah, sure. So first of all, and this is, again, prior to the pandemic, but especially important now, we want to ensure that you do make an appointment ahead of time rather than walking into a blood drive. This is going to really help us ensure that social distancing between donors, making sure that we have appropriate numbers of people in our facilities and in our donation areas to make sure that we can adhere to our guidelines and to the CDC guidelines. So you want to make sure that you book an appointment ahead of time. And then when you get there, anyone who's entering the donation area is going to have their temperature taken prior to entering, making sure that they are at an acceptable level to get in. We have our hand sanitizer station set up prior to entering the donation area, and then of course throughout the donation area as well for opportunities to use. Our beds, the actual donation beds that our donors lie on to give their donation are spaced out according to CDC guidelines. Even the canteen station, where you go for your refreshments after your donation, we're really ensuring that those are that we are spacing our donors and our volunteers and staff out at those locations as well. The waiting areas, so making sure that that social distancing is adhered to. And really critical here, we are enforcing we do need to have anyone who enters the donation area wear a face covering or a mask, and ensure, that they are adhering to that prior to entering. Also, our team, we always, our team always wears gloves and disinfects, and that's a constant, but we have, of course, heightened that even more, making sure that we are constantly disinfecting those donors touch surfaces. And, again, during your health history check, which is one part of the process, you're going to get another temperature read as well. So really two there, just to ensure that those who enter the area are healthy to do so on the day of their donation.
I noticed, it's interesting because I noticed the extra precautions too when I went for the first time. And it was actually I had a long delay. It was very busy that day, but I noticed even the chairs we sat on, which were spaced, 6 feet apart, they were, even though as soon as we got up, they were disinfected, and they were, everybody was being very careful about all the process that they had. Also, I remember when I started, I didn't have the app. And so that process also delayed things because of the whole interview process. And I wondered if you could tell people who might not be familiar with, because this is a game changer, I feel, with time saving and everything, about the Red Cross app. Can you talk about that?
Yep, absolutely. So there are many different ways you can book an appointment. And like I said before, booking that appointment is really critical to maintaining that donor flow, especially in the pandemic. So aside from the app, I'll just make sure I run through everything. We can call 1-800-RED Cross to make an appointment, redcrossblood.org to find a drive near you. You can also, if you have the blood donation skill enabled on your Alexa Echo device, you can also go ahead and request an appointment through that. And then there is the app as well. So our blood donation app, it is free. to download. And it's really a fantastic tool because you can do so many different things through it. One, you can make your appointments. Two, you can track your donation. Really interesting to see where that donation, ends up going after the process. So, and what potential patient or excuse me, what hospital it is being sent to, which is really neat. And I hope you got a chance to see that as well. So, that's part of the process. But what's great about that, you can do it on your computer, or you can do it on your phone through the app. But we have something called Rapid Pass. And this is something that allows all of our donors who do it to really kind of cut down about 15 minutes of time during their donation experience. When you typically go to a drive, you'll check in with a blood donation volunteer, have a seat in the waiting room, and you'll begin the pre-donation reading, because on the day of the donation, we want to ensure that you're looking at all of these classifications, making sure, are you feeling well? All of these different check marks that you want to hit in order to proceed with the donation. So a lot of that can actually be done on your mobile device, on your app, on a laptop, prior to heading to the drive. And you can do that so that when you arrive, again, you're cutting down that pre-donation reading so that it eliminates that step. You can go into your health history right away, talk with our phlebotomist privately, and they'll do a mini health check there, ensure you're good to go, and get you onto your donation process. So really, it's a time saver. And it certainly helps right now with that flow of donors to ensure that we can maintain that social distancing during the pandemic.
And I certainly can testify to that. I do think that 15 minutes is a good gauge. As I said, the first time I went in, I didn't have it. So I did the process of it was almost like 2 interviews going from, table to table, and the temperature check again and everything. Yeah. But then I got the app and the Rapid Pass, which helped a lot. And it's very easy because I actually have it right on my phone. You probably can't see it, but I have it right on my phone. Yeah. And I love the fact that, as you said, I can make my appointment there. I was really touched that I could see where the blood went to. I could see it was processing, stored, and then I could see what hospital it went to, which actually was amazing to me, because I wonder how many people wonder that. And then the other part that I don't know if this will continue or if it's just for the pandemic, but that you get the antibody results.
Mm-hmm, mm-hmm. Yeah, we are continuing that for the foreseeable future. This is a fantastic tool, and really our intent is to help save even more lives for those that are currently battling the coronavirus. So what is happening right now is every single donation that comes into the Red Cross, whether it be a whole blood donation like you gave, a plasma donation, a platelet donation, these are blood products, components of blood. So any kind of donation that you make to the Red Cross is going to be tested for those COVID-19 antibodies. So I'll be clear and say this is not a diagnostic test to show that you have COVID. This is an antibody test to see if you may have been exposed to the virus at some point in the past. Typically, those antibodies are present in your blood for quite a few months after you may have been exposed to the virus. So if that's the case, what we're able to do is to see that if there are donations that contain those antibodies, we can potentially take those donations and extract a convalescent plasma product from that donation. And convalescent plasma has been really critical throughout this process, because that is a tool that we can use to provide to hospitals, to those critically ill patients battling coronavirus currently. And this is an infusion that they can get that can potentially, help them recover. So really fantastic. What we've been able to see is about 800 blood donations that are coming in that are testing positive for antibodies have been recently able to provide about 800 units of convalescent plasma per week in recent weeks to be able to help those that are currently fighting the virus. So this is fantastic. That's why we want to let everyone know at this time, our need is great for convalescent plasma. As the winter continues, or we're getting into the winter and we're seeing these COVID cases rise again, the need for convalescent plasma continues. Our demand is high, but our supply is low. So anything we can do to get the word out, about the need for convalescent plasma donations specifically, and then also whole blood donations that possibly contain those antibodies to help with convalescent plasma is really critical right now. So we encourage people to make appointments.
I think that's fascinating about the use of the antibodies. When if you've been exposed and you get that information, how they can use it. And I was curious as to whether or not somebody had to indicate it, but I'm glad to hear that. Know that once if it's present, it's used, and for the benefit of all those people.
Right.
Thank you for that. When we come back, we're going to continue our discussion about the blood drives for the Red Cross, as well as talk about the many other vital services they provide. So we'll be right back after this short break.
So you think you're safe in your COVID bubble, huh? You don't wear your mask because you're around each other all the time and you trust each other. If only it were that simple. Let's say you go over to your neighbor's house. That's okay, right? They're in your bubble. But your neighbor goes to work and has a coworker that doesn't wear a mask over his nose. And that coworker has a family and grown children that also go to work. Your neighbor also has a close relative who goes to bonfires at another friend's house regularly, where everyone is close together but don't wear masks because they're outside, and they all have families and coworkers. That's just your neighbor. That doesn't include your neighbor's neighbors, or your sister, your aunt, your best friend, or even your dad. The point is, everyone you know has a network. Everyone in their network has a network, and it only grows from there. So when you think you're hanging out with just 10 people, you're really hanging out with 100, 500, maybe 1,000. We'd hate to burst your bubble, but you don't have one. So think twice before venturing out. Keep your guard and your mask up whenever you're around anyone who doesn't live in your immediate household, even if they're trusted family or friends. That's the best way to stay safe and healthy.
Hi, welcome back to Sure Things. I love that public service announcement, by the way. I'm here today joined by Communication Director for the Red Cross, Allie Barraza. Hi, welcome back, Allie.
Hi, Mary. Happy to be here.
Good. So we were just talking about the fascinating part about when we donate blood and it's analyzed, that we can get the information ourselves as whether or not we have the antibodies. Which it's interesting because I know I talk about my neighbor that we usually go together, and we talk about that because we're in a small neighborhood and we always are wondering, have we been exposed? You know, we don't think we have, but you never know. You know, with the comings and goings and the things we do daily. So that's always been very interesting information. I'm going to ask a little bit of an offbeat question because I'm not sure you have the answer of this with Red Cross, but I know there's been information. I won't even say it's research. I don't know. Does the Red Cross have information? Do you have information about a certain blood type and COVID, or no? Is that just not valid research at this point?
As far as a blood type that's more prone to being diagnosed with COVID-19, we don't have that research of it. Yeah, really, it's, you know, we are seeing the need for as far as I will say in terms of convalescent plasma, we are seeing a great need for AB type plasma that is needed to help patients in need that are currently fighting the virus. So I'm not sure if that gives a little insight, but as far as specific blood types go, I wouldn't be able to speak to that. Yeah, good question though.
The other part I wondered, Allie, because you mentioned this, how you can donate blood and that's whole blood. And then there's all these other parts you mentioned.
Mm-hmm.
You know, looking over my donation information when I go to sign on, is there a specific way you indicate, the donor indicates, I'd like this to be used for platelets or whatever? How does that get determined, how it's used?
Great. Another great question. You know, we really do focus on our demand. We want to make sure we are right typing what we are sending to our hospitals and patients in need, because demand changes. There could be a tremendous amount, a tremendous need for whole blood at one point. There could be, you know, again, a tremendous need, as we're seeing right now, for convalescent plasma. So in these situations where we are able to draw out you know, different blood products, we will take the opportunity to do so. But really, when you're sending a whole blood donation, typically you will get that tracking to show where your whole blood donation is going to hospitals, because really the need for that does not stop. It is every 2 seconds someone across the country needs blood, whole blood. So your donation out at your community blood drives, if you're not giving a specific platelet or plasma donation, which you can do, it is typically going for whole blood needs at hospitals. either in Connecticut or across the country, because we have, as the Red Cross, we have the unique ability to send it to where it is needed the most. When we have disaster situations, storms that disrupt our collection ability, we know that our donors across the country can help in those situations because we can transport it to where it's needed.
Yeah, that pretty much answers that question, because I really did wonder. I thought there was perhaps a different process, and I might be wrong on that. I thought it was a different process for if you were giving whole blood or something else, but it doesn't.
Yeah. Now you can certainly go in and schedule a specific plasma or platelet donation rather than just doing the whole blood donation. Those donations aren't going to happen at community blood drives. They require specific equipment, that sort of thing. So they're happening at our brick and mortar facilities, like our Farmington headquarters in Connecticut. So those are specific donations. They take a little bit longer than a whole blood donation would. But for example, you can designate and give a platelet donation that is going to essentially draw the platelets out of the donation that you're giving and replenish the remaining components back to you. And platelets are important because they're a key, say this 3 times fast, key clotting component that really a lot of cancer patients rely on for their treatment. So we like to call our dedicated platelet donors cancer kickers, because they really are helping with cancer patients' treatment. Plasma donors specifically, not specifically convalescent plasma, but plasma in general really can help with providing treatment to burn victims. And then of course, whole blood donations, anything from a trauma victim who's been perhaps in a car accident, those who, any kind of trauma victim, those who are living with sickle cell disease, the certain types of patients like that really do, surgery patients, transplant patients rely on whole blood products to help save lives. Really, you are helping to save lives with each donation.
Yeah, that is the important message for sure. Now, you mentioned when we were getting ready for the show that that January is an important month for Red Cross. Could you talk a little bit about that? What's going on?
Sure. Yeah, it's National Blood Donor Month. So really, we think every month should be that, but really this is the month where we want to recognize our volunteer donors. We cannot do what we do without the generosity of our donors, like yourself, like so many others watching. So, this is National Blood Donor Month. We want to just say thank you to our volunteers, not only our donors, but those who volunteer at our blood drives, really showcasing the need for blood and how vital they are to our mission. So National Blood Donor Month, we're just thrilled to be able to highlight our donors that make such a difference in patient lives.
During such an important month, do you set goals for local facilities set goals, or it's just more of a communication push to make sure people are out to donate?
Well, it's certainly just a national push to recognize. It's really a thank you moment. Certainly, we have our goals to meet patient needs. We want to ensure that our the demand is met from our hospitals that we service in our territories, of course, and that's constant. But really, this is a thank you, and highlight the importance and encourage people to continue to make appointments, because really the need isn't going to stop, whether it's a pandemic, the holidays, bad weather in the winter, the need isn't going to stop. So we need to just continue to ensure that we push get that message out there that making appointments is critical. If things are booked right now, look ahead, a month, a couple of weeks, and see what's available in your area. We have plenty of different options in our communities that we serve, and we're going to need it. So.
Yeah, and I did notice that even on the app, I know I keep promoting the app, but even on the app, when you go to schedule, you have a calendar there. So if you make 1 week, you can, and then they also tell you when you're able to donate again, which I found
every 56 days. For whole blood. Yep.
I found that very helpful. I know we talked a lot about the blood donation, but it is, as you said, a very important month for that too. I know the Red Cross is involved in so many other crisis management and other events. How would people get to know more about the Red Cross and the services?
redcross.org. Really, you're going to see all of our lines of service there, disaster services, how we help after home fires, of course, our training services as well, CPR classes. So please, redcross.org is really your best resource for that.
That's great. Well, Allie, I'd like to thank you once again for being on our show today. on Sure Things and to informing us and letting us know how important it is. Those that can and are willing to get out, and now the people that don't have the app but they'd like to know where to donate, would it be the same place they'd go to the website to find out where to locally give?
Yep, redcross.org or redcrossblood.org, or you can call 1-800-RED-CROSS.
Okay, great. Okay, well, that does it for our show, and I'm glad that we have learned that information and that we have the resources to know where to go for additional information as well. So thank you again, Allie, for joining us and giving us that info. And I'd like to thank everyone else for tuning in to Sure Things. Please join us again. Until then, stay safe and take care of each other. Bye.